is about the connection between COVID-19, hydroxychloroquine, and Acharya Professor Ray. You know that Acharya Professor Ray is considered as the father of Indian chemistry. And it was his small laboratory initiative, or a small rented home of his, which was converted into this company called Bengal Chemicals Private Limited. It was PC Ray. Yes, it was actually his. Yeah. Are you trying to talk to me?
Share the slides once more. It has gone. No problem.
Can you please pin on the video? It's for me. It's showing that I am already sharing the video, sharing the slides. Can you please try to pin on the video or the slides?
Go to people. You can go to the people, and there you can see Anu Thomas presenting. Anu Thomas presentation. Then using a pin option, you can pin it, and your presentation will be viewed.
Is it visible, ma'am? Shall I proceed, or should I stop once again and start presenting again? Or is it
not
visible?
able to see.
Okay, you can go to the right hand side. There is the people, where we can see all the participants, and if you scroll down, you can see Anu Thomas, and in bracket there is in presentation, and click there, and just pin it. There is an option called pin. There are 3 options, 1 or 2 options. So you can mute or pin it there. Have you seen?
What about others? Are others able to see the slides? If not, I can stop and start presenting again.
Okay, ma'am. Some of them have problems, and some they will eventually make it right. Okay, you can continue now.
Okay. So we have seen that it was Acharya Professor Ray's initiative, which was converted into Bengal Chemicals, and the production of hydroxychloroquine was stopped decades ago. Hydroxychloroquine is actually an anti-malarial drug, and during the World War II, malaria was widely spread, and it was found that hydroxychloroquine or chloroquine or quinine can be used to treat it. And during that time, quinine was isolated from the bark of cinchona tree, which was widely available in Latin American countries. So it could be easily manufactured in the US companies, and slowly the production of hydroxychloroquine in India was stopped. That is the history behind this drug. And this is the only connection of Acharya Professor Ray and hydroxychloroquine is that it was manufactured in Bengal Chemicals, and he has no direct connection with the discovery of this drug, in contrary to the social media posts. As we are all, as many of you are from chemistry background, I have included the structure of this drug and its IUPAC name. Now let's move to a little bit of chemistry in ancient India. As you know, now the names BC and AD are replaced by the terms BCE and ACE, before the Common Era and after Common Era. Going to the BCE period, we know that it is divided into 3 ages, that is Stone Age, Bronze Age, and Iron Age, based on the tools used by man for hunting or their livelihood. Indians had some knowledge about chemistry from the BCE period onwards, which is evident from the pottery, cement, bricks, and minerals excavated from Mohenjo-daro and Harappa sites, which are part of Indus Valley civilization. On the right-hand side, I have given a table which shows the period. Bronze Age is called so because people, after the discovery of fire, people discovered bronze, which is an alloy of copper and tin, and found out that better tools than stone can be manufactured with bronze. Now, if you want to connect it to the world history or the history in the Bible, it is during this period from Noah's Ark to the period of Moses. Just it is a little piece of information, that's all, and it has nothing to do with chemistry. And after that comes the Iron Age. Iron Age means iron was discovered and wrought iron was discovered. And during the Iron Age, people in India produced a special kind, it is known that people in India produced a special kind of polished pottery known as northern black polished ware, and the golden glows of that pottery is still a mystery and nobody knows the chemistry behind it. And also, we know that the Vedas, Rig Veda, Yajurveda, and other Veda, in it there is a detailed mention of precious metals like gold, silver, copper, iron, etc. And mercury was very important in ancient scriptures. It is all explained in detail in our Vedas. And Chanakya, who was a teacher at Takshashila, has made references to metals, alloys, and minerals in his famous Arthashastra. Also, we know that Ayurveda was originated in India nearly 4,000 years back. And we are all aware of the Panchabhuta theory that all living and non-living things are made up of 5 basic elements. Now, again, going back to the world history, it was around 400 and 300 BCE that Greek philosophers like Empedocles and Aristotle said that all matter is made up of 4 things, that is earth, fire, air, and water. And also later on, it was found that all matter is made up of atoms, which are indivisible part of matter. And during the same period in India, Kanadan also said that everything is made up of anu or paramanu. So we have a good history background in the olden days. Now coming to the ACE, that is after Common Era, or earlier it was known as AD. It was coming to the 5th and 6th century. It was during 5th and 6th century that alchemy developed in India, and also as a part of alchemy, iatrochemistry was developed. I guess all of you know about alchemy. The main goals of alchemy was to find out the elixir of life, and to find the philosopher's stone, which I have not included in the slides because I know that you all are aware of these things. The philosopher's stone is something which can be used to convert any cheap things into gold. So they conducted a lot of experiments, and ultimately they were able to discover or invent a lot of things. And in 6th century, Varahamihri has written about high-grade steel manufacture. And during that period, we must be very proud that Indian steel swords were exported to Persia. And some of the events are discussed here. And you should also understand that Ayurveda and iatrochemistry, or Rasa Shastra, which is a special branch of Ayurveda. Rasa Shastra is a special branch of Ayurveda which mainly involves mercury. And Nagarjuna was a Buddhist sage who is considered as father of Rasa Shastra. And all these developments were in the initial centuries. After that, during the colonial period, chemistry was not that flourished until by early 1800s, European scientists started coming to India, and a science college was established in Calcutta. The study of chemistry was first introduced in Presidency College in Calcutta in 1872. So there was a long gap during this period. The chemistry or study of chemistry was not that much flourished during this period. It was in 1800s Now going back to Acharya Professor Chandra Ray, it was in this college, that is that Presidency College, that Acharya Professor Chandra Ray studied, and he was the one to identify the fact that chemistry was long forgotten in India, and he made a research on India's indigenous chemical practices from the Vedic era onwards, and published it in the form of a book called History of Hindu Chemistry. So he was particularly interested in chemistry. Initially, he was interested in arts and literature, and later on, to study arts in college, chemistry was taught as a subsidiary subject, and he was particularly inspired by the chemistry courses taught by Professor Alexander Pedler. And later on, he took chemistry. And he got DSc degree from Edinburgh University and started teaching chemistry at Presidency College in Calcutta. During that time, he conducted smaller experiments in his rented house along with a few of his students, and it was later on converted into Bengal Chemicals with just a capital of about rupees 700. That's all about Acharya Professor Chandra Ray, and I advise all the students to read his biography in Wikipedia. It's going to be very inspiring. And he never took any salary from the company. And later on, after his death, he was honored with many awards and recognitions, even from the Royal Society of Chemistry and so on. So that is the history about chemistry in India. And it was him who identified that chemistry should be studied, or science has a good role in a country's growth. So now let's go to the title. You know that COVID-19 pandemic, it's the COVID-19, the full form of COVID-19 is coronavirus disease 2019. It is caused by coronavirus SARS-CoV-2, and the full form of SARS is severe acute respiratory syndrome. We know that it is the respiratory system which is heavily affected once you are infected with corona disease. Corona in Latin means crown-like. Now let's look into the chemistry of a virus. Most of the viruses consist of three components. It has a genetic material, it will have some proteins, and it will have a lipid layer. And the genetic material in coronavirus is RNA, which is single-stranded. The whole setup of this is assembled in a lipid layer like an envelope or a bubble. And you have seen this well-known figure in which you see certain spikes protruding out like a needle when hit on a ball or a balloon looks like. It is a structure of corona, and these are actually glycoproteins protruding from the surface. Compared with human cells, the coronaviruses are small and they cannot reproduce on their own. They have to enter into human cells for their production. And for that, they use these spikes, which are actually glycoproteins. Usually, the cells of human beings are not open to everything. It is often closed. But coronavirus spikes act like keys to open these locks, and they try to enter the human cells. Once it enters the human cells, the virus will undergo a structural change and fuse into the cell and transfer its RNA or the genetic material to the cell. And or in other words, the virus will be hijacking human cells, and then it will turn our cells into a coronavirus factory, which is then producing more and more coronavirus. So that is the mode of attack of coronavirus. Now the question rises, why the lungs are most affected by COVID-19 virus disease. It's because there are special receptors called angiotensin converting enzyme or it is called ACE2, which are certain receptors in the alveolar cells of human beings, and it has a structure like this. And the spikes of coronavirus are of the right size and shape to latch into this ACE2. As you can see in this figure, it fits in perfectly to these receptor cells. I assume that you have studied the enzyme substrate and lock and key mechanism. It uses a mechanism like that to fit in perfectly to these cells. Once attached, this genetic material will be moved to the cell, and it starts to replicate and produces many copies of the viruses. But don't curse these spikes a lot, because these spikes are actually a blessing in disguise, because it is key to the antibody test that helps us to find out if a person have had COVID-19, and it is also key to produce vaccines. Now, let's go to the chemistry behind washing with soap. Mm. And the question arises, why it's always said, am I presenting? Is it visible? Because here a message has come that the slides stopped presenting. Are the slides visible? Is it moving? Somebody please unmute the video and answer.
Yes, miss.
Okay. Okay. So the question arises, why we should wash our hands with soap. As I said earlier, if you look into the structure of coronavirus, it is held together by a fatty layer, which is called an envelope or bubble. And this layer is disrupted when it comes into contact with soap, which is actually a surfactant, and a hand sanitizer with more than 60% alcohol. So the one mechanism or one way is that this surfactant can destroy the oily or lipid or envelope of coronavirus and disrupt its structure, and it is the same with the case of alcohol also. So I think it's better to look into the chemistry of soaps a little bit. Soaps are actually sodium or potassium salts of higher fatty acids. Now the question arises, what are higher fatty acids? Fatty acids means acids which have long chain of carbon atoms. Usually the number of carbon atoms will be greater than 12 or so. So if you look into the structure of soap, it's almost like this. It has a tail and it has a head. The tail is actually a chain of carbon atom, and the head is actually, it has charge, or we call it as polar. The tail part is non-polar, or in other words, hydrophobic, and the head part is polar or hydrophilic. So how this structure helps us? Usually, if you look into this picture, usually the dirt is attached to our clothes or our skin with the help of oil or grease, which is produced by the sebaceous glands of ours. So it is attached with the help of oil. And if you wash with water alone, this oil or dirt cannot be detached from the cloth or our skin. When we add soap into water, what happens is soap will come like this, with the tail part or the non-polar part attaching to the dirt or oil, because we know that like dissolves, the universal law that like dissolves in like, or the non-polar part likes the non-polar oil or dirt. So the soap molecules come like this, with all the tails coming to the dirt part, and finally the dirt or oil will be detached from the cloth. And as a result, the oil or soap molecules along with oil droplet in the middle assume a spherical structure like this, which is called micellar in chemistry. It has inside region is non-polar and outside it is polar or hydrophilic. As it is hydrophilic, it will dissolve easily in water, and then after rinsing with water, it will be washed away. Same is the chemistry when we wash our hands with soap for about 20 seconds. The dirt, which also contain bacteria or virus, will be attached with the help of oil or grease, and the soap molecules will come like this. And after attaching the nonpolar part to the oil or grease, it will detach from the surface or skin like this in the form of a micellar. And you should understand that the micellars will never aggregate together because they have charges outside and they will repel. And it will be soon rinsed or washed away with water. Or in other words, if you look into this picture, as I said before, soaps are actually surfactants, and they will attack the glycoprotein or the lipid part of coronavirus. And it will try to it will open the structure, or it will damage the lipid protein covering or envelope, and the fragments will be taken out, and the fragments will be washed away with water, like seen in this three diagrams. So that was a mechanism of or action of soap on coronavirus, and I hope now you have understood the importance of washing your hands with soap after being exposed. Now let's see what happens in the case of alcohol. We have heard from the WHO standard that when you buy a hand sanitizer, it should contain at least or greater than 60% of alcohol. It is because that percentage of alcohol can only disrupt the lipid layer by denaturing the proteins. That is, it's actually disrupting the hydrogen bonding of the glycoproteins, and as a result, it is denaturing the proteins. I guess all of you knows the term denaturization of protein or denatured protein. So once its structure is destroyed, it cannot be effective, or it cannot enter the human cells for reproduction. And I have seen people worrying because they did not get a hand sanitizer or so. And there's no need to worry on this, because soap, even the cheapest soap available in market, is good to destroy coronavirus. And you should understand that some of the hand sanitizers will be, if they have less glycerol or glycerin content, you know that after washing, somebody is playing music in between. Okay, so so if you after I am sure you must have noticed that after washing our hands with sanitizers, your skin has dried out a little bit, right? Due to drying, there is a possibility that small pores can happen or can occur in your skin, and again it will attract virus. So it's always better to wash your hands with soap. And in order to avoid the drying out, we add glycerin into soap or alcohol or hand sanitizers, because again chemistry plays its role. Glycerin is actually a humectant. That is, it builds a shell of water around it, and due to the osmotic pressure difference, it drives more water into the locality, or our hands will not, or hands will be moistured. There is the phenomenon called osmosis happening there. So I hope it's clear about the structure of the virus and the action of soap, alcohol on it. Now let's look into the chemistry of COVID-19 detection tests. The main test used to find out if a person has COVID-19 or coronavirus infection is PCR test and antibody test. In PCR test, actually, a nasopharyngeal or throat swab samples are used, and in antibody test, blood is used to detect. And it's interesting to understand that in PCR test, it's actually looking for the antigen or virus, while in antibody test, it's not looking for the virus, but it's looking for antibodies. The advantage with PCR test is that you can find if someone has the virus very early on. And regarding the antibody test, I will say a little bit about antibodies, because as 90% of you are from chemistry background, you may not know what are antibodies, though you have learned in your higher secondary classes a little bit of biology. It won't take much time, but I will just make you understand what are antibodies. When a new infection or a virus or a bacteria enters our body first act uh, by producing antibodies. Or antibodies are the things first produced by a body to defend against the virus or the bacteria. These antibodies will attack the antigens or virus or bacterium. This is the same thing when happening when we get a vaccine or a flu shot. That is, try to develop immunity to a virus. And talking about the antibodies, the first set of antibodies formed are called immunoglobulin M. As you are from chemistry background, you will understand that globulin means they are a special kind of protein. So you should understand that these are again proteins. And for easiness, we will call it as IgM. And these proteins will bind with the virus surface and try to stop it from working. The problem with this type of antibodies is that it cannot last long, and it will be gone from our blood within 3 or 4 weeks. The second set of antibodies which are formed in our body are called immunoglobulin G, and they are better tailored to the antigen. They are the basis for much longer term of immunity, which can last for many years or even a lifetime. And since we are chemists, it's better to understand that both these are glycoproteins and they have similar structure, but their stereochemistry is different, and they use and as a result, to dock with molecules, they have different mechanism, or they use hydrogen bonding to dock with another molecules. So that's all about antibodies, and let's go back to the test. How is the antibody test done? It is, as I said before, it is not looking for the virus, but it's looking for the antibodies. If a person has coronavirus disease or coronavirus has entered into a person, his body must have produced antibodies. So this test is actually looking for antibodies. In this test, blood is analyzed for the presence of IgM and IgG antibodies. Patient's blood serum is taken, that is, from the blood, red blood cells are removed, and the serum means it's not at all red in color, it has a pale yellow color. And then it is put in a vial which is coated with the antigens. It is then if it has antibodies, it will perfectly fit in with the antigens, and after putting it in a colorimeter, it will show sharp color. Don't worry, I will explain it again later. And now we are very happy that rapid test kits are available, or the mechanism used is lateral flow assay, and this is how it looks like. And in the instructions, they have said that first we should prick our finger and collect a little bit of blood sample, and the blood sample should be put on the sample well, which is this one. I know that it looks more or less like a pregnancy test kit. Okay, and then we add the blood to the sample well, and along with the kit we get a buffer solution, which is actually a 10 millimolar phosphate buffered saline, which is used to keep the pH constant. And then after some time you get the result. So the result is ready between 2 and 10 minutes. Now let's look how this happens, or why we are getting this red color. You know that when after we add the blood into the sample vial, this is the sample pad, and the blood will go by capillary action to a pad known as conjugation pad. this conjugation pad has nano gold particles, or at least or 40 nanometer gold particles, or sometimes the dimension can vary between 20 to 60 nanometer. And this gold nanoparticles are conjugated with coronavirus antigens, as you can see in this figure. Here, in this region, we have gold particles conjugated with the virus antigens. So, after we add the blood into the sample pad, the blood will start flowing into the conjugation pad, and it will meet these gold particles conjugated with antigens. If antibodies are there in a patient's blood, these antibodies will perfectly fit to the antigens, or they will try to fight with the antigens. It's more or less like a jigsaw puzzle being connected, and then it will again move laterally, and after that we see three lines. It is M, G, and C. If there are IgM antibodies in the patient's blood, you will get a pinky red line here. If there are IgG antibodies, you will get a pinky red line here, and this is the control. So again, this M line, that is IgM line, will be shown only if the body, if the blood has human IgM antibodies. It cannot recognize any other IgG antibodies, and any IgG antibodies will be binding there. And the same is the case with IgM and IgG. And the last line, it's something more biology related. I'm not going into the detail. And the only thing we have to understand that if there is a pinky red line in the control region or C, our test is valid. So a positive test is shown here. If if only one pink color or line appears here, it means that you are early in the infection, because those antibodies are formed earlier in the infection. And if you have a pinky red line here, you understand that you had a late infection, or even if you have recovered, you will get a pinky red line here, and both lines shows an ongoing infection. So this is how the test works. And I know that we are more interested in the chemistry behind it, why this pinky red line is obtained. As I said before, the conjugation pad has gold nanoparticles. So this was one application of gold nanoparticle. Why gold nanoparticles are specifically used and not any other metals? Any other noble metals are used for such test. Just because gold nanoparticles are usually they are chemically stable, and it can be produced in a number of morphologies and shapes and sizes. Also, the synthesis is it can be produced through a different synthetic methods, and it has a high surface density of free electrons, which results in inherent optical, electrical, and catalytic properties. And also there comes one term called surface plasmon resonance, which exists between 510 to 1000 nanometer, and due to this, all these nanoparticles can show some color. We have seen just one application of gold nanoparticles, that is in detection of viral diseases. It has many other applications, like it can be used as nano coatings, it can be used as sensors, it can be used for drug delivery, and so on. Now, for those people who are very new to this field, I will make you understand what is surface plasmon resonance in a very simple way. You know that the color of bulk gold is yellow, right? But when we go to nanometer regime, it shows different colors, and the most striking one is ruby red color. This is the well-known Wikipedia image. If you search in Wikipedia or Google about nano gold, you can see this image. So the color changes from yellow to ruby red when bulk gold is converted to nanoparticulate gold. This is due to a phenomenon called surface plasmonics. Before that, a little bit of history too, because as I said before, I'm too fond of history. This is a 4th century Lycurgus cup, or it is a Roman glass gauge cup, which changes its color depending on the location of light sources. It's because it has embedded silver and gold nanoparticles, or colloidal nano gold and silver particles in it. And if you view this cup in reflected light, it will show green color. And if you look into this cup in transmitted light, it appears red. So the Romans knew about colloidal nanoparticles from the 4th century onwards, but it's still a mystery why it shows different colors depending on the location of the light source. So that was given as a stress reliever. Let's go back to some science or chemistry. Now I will make you understand what is surface plasmon resonance. Um, we know that gold has 6 electrons in its conduction band. When it is exposed to visible light, we know that visible light is an electromagnetic radiation, and it has electric and magnetic components in it. When gold metal is hit with visible light, the electric component of the light will cause the electrons to displace a little bit with respect to the nucleus. It is shown here. When it is hit with visible light, due to the electric field, the electrons in the conduction band will be displaced a little bit from the nucleus. If red is the atom, and the electrons are displaced a little bit, and as a result, a dipole is formed. This electron oscillation will cause a charge separation, or, as I said, dipole oscillation. The amplitude of this oscillation will reach a maximum at a particular frequency called surface plasmon resonance. I hope you understood what is surface plasmon resonance. That is, the amplitude of this oscillation will be maximum at a particular frequency of the visible light called surface plasmon resonance. This surface plasmon resonance will induce a strong absorption of the light. That is, it occurs because light is absorbed. And as a result, what happens when a certain wavelength or frequency of the light is absorbed, it will show the color complementary to the absorbed light, right? We have learned Vibgeo. So if a particle absorbs light in the green region, it will show a red color in the transmitted light. Coming to gold nanoparticles, and particles with size above 100 nanometer have broader peaks in the spectrum, and also those with below 2 nanometer do not show surface plasmon resonance. That's why we are using gold nanoparticles in the dimension of 20 to 60 nanometer in all these detection tests. Now, I'm sure you understood why the gold nanoparticles give a pinky red or red line in the rapid test kit. It is because it absorbs green light of 520 nanometer and produce its complementary color of red. Now, why or how gold is conjugated to these biomolecules, or why gold is taken when compared to other noble metals? It is because the gold nanoparticles, or the dimensions of gold nanoparticles, are almost similar to the dimensions of biomolecules like enzymes, antigens, antibodies, or DNA. So it's always better to take gold for bioconjugation. So, and also you must be wondering how they are conjugated to the biomolecules. It takes by a number of it happens in a number of ways, because the gold particle can be functionalized with a lot of functional groups, and then the chemistry will be different. But the main bioconjugation occurs through 4 major approaches, as shown here. One can be an electrostatic absorption between biomolecules and negatively charged nanoparticles like this. And also there can be covalent bonding between the functional groups. And also there can be the conjugation to a small cofactor. by a small cofactor, like a Locandine mechanism, it can be. And sometimes it can be by a chemisorption, because most of the biomolecules contain thiol and amine groups. So it can be also a chemisorption. This is one more illustration. As you can see, a gold nanoparticle can be hydrophobically attracted to an antibody, or it can be an electrostatic attraction, or it can be a dative covalent bond between, like in the case of thiols and other sulfur or amino acids. So that was all about the chemistry behind the detection tests. Now, let's look a little bit into the drugs. The usual, or everybody asks why we have not discovered drugs to treat COVID-19, or how long it will take to develop them. The answer is that coronavirus is completely new, and it attacks cells in a novel way. The mode of action or mode of attack of every virus is different, and so the drugs used to treat them. So it takes more time and experiments to tackle the new coronavirus. Now, let's look into some of the drugs about which we have been reading in the newspapers. We have already seen that chloroquine and hydroxychloroquine are better drugs. Actually, they are anti-malarial drugs. Malaria is a parasite, but still it is useful in the case of this virus attack. And it is almost understood that how the chloroquines actually change the acidity at the surface of the cell, so that the virus cannot attack it. Somehow the acidity at the surface of human cells are changed, so the virus cannot attack the cells. Recently, we read that hydroxychloroquine can be used in combination with azithromycin, which is a well-known antibiotic, to stop the spread of infection. Also, we read remdesivir, developed by Gilead Pharmaceuticals in the US, is found to be very highly effective. And how it acts is that it prevents the virus from replicating. And very recently, we have read about the drug favipiravir. Is used in treating COVID-19, and in India, Glenmark Pharmaceuticals has got the license to conduct phase 3 clinical trial. So until now, no proper drugs have been discovered, and the chemistry of the action of drug on coronavirus is extremely complicated, and I will conduct a webinar on that later on. And I hope you understood the basic behind the virus attack, the action of soap and alcohols, the COVID-19 tests, and what are the common drugs used, and why gold nanoparticles are used. So we are very sad about the drugs. The proper drugs are not found out. Anyway, let's hope for the best, and thank you for your patient listening. Thank you.
Thank you, Anumis. And now it's time for some discussions. You can raise your questions in the chat box. And after the discussions, I will put a Google form link there, and you can type your feedback. And using this feedback, we are giving you the certificates.
I guess the talk was too simple.
Ma'am, there is a question there. Can you read that? Harishankar.
Just I will check. I cannot find it. What are the practical difficulties in developing a vaccine for COVID? It's actually the clinical trials. Once the vaccine is ready, we have to get the approval for the clinical trials. So everything takes time. Those are the practical difficulties associated with developing a vaccine. And more or less, I'm from chemistry background and not from pharmaceutical background. So if there are other difficulties, I will have to look into it. Of course, there is a second question. Can we do detection at home? Of course, it's very easy. And as I said, it's more or less like a pregnancy test, and you get the result within 4 minutes. And the kit is coming with a needle to prick your finger, so it's very easy to perform it. The buffer solution also comes with the kit.
There are other questions. Can you answer that?
Unfortunately, I didn't see it. Oh, is there any predictive technologies to know future mutations possible for corona? To my knowledge, no, there are no predictive technologies to know the future mutations. Because viruses are undergoing mutations a lot. We know that earlier it was understood that it cannot withstand extreme weather conditions, but the virus have now undergone mutation and it has adapted to the extreme weather conditions, and it is even surviving at our summer weather conditions. So I don't think there are much predictive measures to understand this phenomenon. Of course, by computer simulations, you can understand a little bit, but not 100% is possible. Okay, there's one more question coming up. What about arsenic album 30? Unfortunately, I cannot answer that question because I'm not a pharmacist and I don't know about that. Rapid test is not that reliable. After you find it positive, then you have to, of course, go to the lab and get it checked. Are mutations, could you please, are mutations the reason for asymptotic corona? It could be. Can we consider this COVID-19 just like other yeah, fire? It's not a big deal. You know that it is just like a normal flu for a healthy person. You don't have to worry a lot about corona. The only thing is you have to sanitize yourself well. But what about the people without symptoms? The potentially capable of yes, they are. Even without showing the symptoms, they are capable of spreading the virus. Can we take antibiotics? That is the question. It has to be after you have to consult with the doctor and do that. Okay, Ria Matthew has commented that no antibiotics are against bacteria. Antibiotics are usually for against virus, right? Okay. Yes, of course. I will leave the PPT with the organizers and they can share it with you all. I'm not from biology background. I have just looked into the chemistry aspects, which, very simple chemistry aspects of COVID-19. So if I have written or presented something wrong, you are very welcome to correct me.
Thank you, Animis. I think there are no questions left. Thank you for your enlightening presentation on why chemistry matters for COVID. And there are almost 230 participants and registrations, and only 124 can make it into it. There are some technical problems, I think, which we will resolve in the next session. Day after tomorrow, we are having a historical background on the coronavirus. And I have shared a link there. A feedback form is using the Google Forms, and you can fill it out, and you will get a certificate. And thank you each and everyone, teachers, students from different colleges in our state and outside the state. There are so many from Tamil Nadu. There were some from Punjab, Rajasthan, and thank you everyone. This was our second attempt, and the third class will be on Saturday. Okay, and Miss, thank you very much. Thank you for your wonderful presentation.
Thank you, Tony, and thank you, the college management, and especially Punankurian sir, Tony sir, and Shibi Miss for giving me the courage to present this. Thank you all.
Thank you.